having heard about the Barnum effect. This theory may be the theory behind people relating their daily events to stars, astrology, and other superstitions. Let's see, such phenomena can be observed in health-related events as well. Good afternoon, ladies and gentlemen. I'm Gajavan Anathatna, and it's a privilege for me to present our findings to this esteemed audience. Our research was conducted to find out drivers of vaccine hesitancy in rural Sri Lanka, which is a major concern. Development of vaccines was indeed a milestone in public health. Despite preventing millions of deaths and disabilities with clear scientific evidence, there are still various sentiments against vaccines, especially in rural areas. These conspiracies came into more attention after the recent vaccine campaign against COVID-19. These emerging concerns about post-COVID-19 vaccine complications and global emergence of anti-vaccine sentiments was fueled by spread of various misinformation via media platforms. And in this background, our objective was to determine the prevalence and associated factors for complications perceived by participants as being related to COVID-19 vaccination and to identify predictors of future vaccine hesitancy in rural Sri Lanka. Looking at our methodology, our study was a cross-sectional analytical study conducted in a selected division of secondary clinic in rural Anuradhapura. Our population were adults who had received at least 1 dose of vaccine against COVID-19, and the whole population was screened with an 80% response rate, and the data was collected by a self-administered questionnaire. A questionnaire is used to detect and identify what we know. But to identify sensitive topics such as what people believe regarding superstitions, we needed something more. So we conducted a qualitative study in a separate ground-in-the-eye division, and all the findings, insights, and suggestions were incorporated into the final questionnaire together with an extensive literature review and expert opinion. Looking at our results, our total sample consisted of 541 participants with 59% females. Ages ranged from 18 to 85 with a mean age of 46.9, and 77.4% of our population were educated below ordinary levels. These indicators indicate that our population is a classical rural sample. Now let's discuss about the vaccine status of our population. As mentioned earlier, our population includes only those who have received who has vaccinated against COVID-19 with at least 1 dose. 67.3% had received all 3 doses, while 5.2% had received only 1. Several kinds of vaccines were administered, but 41% of the population had no idea regarding the brand of vaccine they got. Looking at comorbidities and family disease conditions of our population, 58.2% were healthy without any chronic medical condition, and 60.8% had a familial chronic disease condition. Do you think having a chronic medical or family history changes their perception about health? The integral reason why the majority of the population, that is 62.3%, agreed to take the vaccine was because the government made the vaccine mandatory, and several restrictions such as public transport and hospital were put on those who did not take the vaccine. Some other reasons include to actually get protection against the vaccine and due to forcing of the family, friends, or the society. With this, the importance of government mandates in enforcing public health policies is clear. And 71% of our population believes that the vaccine they received was effective in controlling morbidity and mortality in both global and local settings. But despite that, 400 participants, that is 72.6% of our population, believe that the COVID-19 vaccine could cause complications. And 300 participants, that is 55.4%, complained of self-reported complications. The most common complaints were joint pain, back pain, fatigue, muscle pain, paresthesia, and asthma. Several other complications such as hair loss, vision problems, hearing problems were reported in lesser frequencies. And in this background, 47.9%, that is 259 of our population, regret taking the COVID-19 vaccine. Can we imagine the challenge the public health sector is facing? You may wonder why people are relating these symptoms to the COVID-19 vaccine. Among the 300 who developed these complications, 95% complained that they were well before the vaccine and all these problems started after. Interestingly, 60% had seen other people who have developed similar or different complications following the vaccine. And 38% has observed people who did not get the vaccine living well, and 12% believed that the quality of the vaccine they got was low. But only 4% had seen any social media posts or videos regarding this matter. During our analysis, we found out that increasing age, low education, having chronic disease, and having familial chronic disease, also interestingly, believing in astrology and believing in Hadipunya were significantly associated with reporting complications. Such beliefs are still abundantly found in rural communities, and it's evident by our results that they affect health-related perceptions and decision-making. The same findings about these superstitions were obtained from our qualitative research as well. Then, independent predictors of reporting complications were deduced using logistic regression with 95% confidence interval. Female gender, increasing age, and having familial chronic disease were major findings. Then let's move on to vaccine hesitancy. Vaccine hesitancy is the refusal of vaccination despite availability, a major emerging public health threat which needs tailored intervention. And through our questionnaire, we have analyzed possible future vaccine hesitancy in 3 levels, that is in individual level for their children and whether they would recommend the vaccine to a friend. 65.8% of our population refused taking a vaccine for themselves in case of a future pandemic. 67.5% of our population refused letting their children take the vaccine. And 65.4% would not recommend the vaccine to a friend or close associate in case of a future pandemic. And when looking closely, having developed post-COVID-19 vaccine complications and believing in astrology were independent predictors of all 3 levels of vaccine hesitancy. That is, people who develop self-reported complications following the COVID-19 vaccine and those who believe in astrology are least likely to accept a new vaccine. In conclusion, day-to-day beliefs of people such as astrology and other superstitions may have a significant impact on how we perceive health-related factors as well. These factors play a crucial role in health-related decision-making. And to overcome these challenges, it's vital to strengthen targeted education, promote health literacy, and actively address myths and misconceptions. This must be done with sensitivity, respecting and understanding cultural beliefs rather than dismissing them, so that communities feel heard while being guided towards evidence-based health decisions. These are some of my references. Thank you.
Great. Very nice presentation, guys.